Examples of specific lessons learned. Elizabeth Davis, founder and executive director of EAD and Associates, spoke to examples of specific lessons learned, focusing on practical application points to address the intended objectives of the workshop. She stated that codes, standards, and guidelines are each uniquely defined, and clarifying these definitions will help to differentiate between the shall and the must in their development, adoption, and implementation. Also, she translated these examples into specific needs, such as measurable outcomes, shift in focus from storytelling to empirical data collection, as well as a repository for this data, and obtain an understanding of the built environment versus evacuation operations. Edwina Juliet, co-founder of the National Task Force of Life and Safety for People with Disabilities, addressed the need for progress in the following three key areas related to emergency preparedness for persons with disabilities: stair evacuation devices, use of elevators for emergency evacuation, and human factors. While such devices seek to fulfill the need of surrounding emergency evacuation, FDA regulations as to their design, use, as well as a collection of opinions on experiences is lacking. She suggests that research leading to standards development is required to address what the human factors should be in such a situation. Lastly, she mentioned ANSI symbol standards as a potential solution for the elimination of language barriers in emergency evacuation situations. Overview and perspective on the population of people with disabilities. David Keir, Program Specialist of the National Institute on Disability and Rehabilitation Research, delivered a presentation aimed at defining the role disability statistics play in understanding the needs of the community of persons with disabilities, pointing out that no one data set covers all data needs. He provided examples of various surveys to review when examining needs related to this community, in addition to various questions to consider when using various data points. Specifically, he covered disability prevalence rates, inclusion of age, gender, race, working age population, and educational attainment from the Census Bureau of 2007 American Community Survey. He concluded his remarks by underscoring the need for improvements in the disability data, as challenges still exist in finding, accessing, and using and documenting relevant and vital statistics about the population of people with disabilities. Additionally, the information outlined in the comprehensive NIDRR research programs related to the rehabilitation of individuals with disabilities can be found at www.ed.gov/OSERS/index.html. Public input, questions, and answers. Alan Frazier, Senior Building Code Specialist, National Fire Protection Association, and Workshop Co-Chair, moderated this session. Issues, concerns, suggestions, and questions were raised by persons with disabilities, advocates, federal agencies, and standards developing organizations regarding the following topics: metrics and research protocol. Concern was voiced regarding the possibility of duplicate efforts and a lack of unity in addressing the needs of the community of persons with disabilities. Workshop participants expressed the need for metrics. It was suggested that the establishment of a recommended quality research protocol could be an appropriate starting point. Additionally, stakeholders are looking for lessons learned and best practices on subject topic. One qualification is that this data is still not supported by any one area. What may be appropriate in one area is not necessarily suitable for another area. Therefore, there needs to be a push to catalog these lessons learned and best practices, including a ranking system as to what worked and what did not work, and reasons supporting these findings.